Hi, my name is Gracelyn Richmond, and I'm a fifth-year PhD candidate at the Albert Einstein College of Medicine. I'm getting my PhD in biomedical sciences and systems and computational biology. I was awarded the Predoctoral Fellowship in drug delivery this year by the PhRMA Foundation. What really set me on my path towards becoming a formal scientist was actually my high school anatomy teacher, Dr. Jim Burr. He was a kooky, unconventional teacher who his teaching style didn't really resonate with most of the students, but it really hit home for me. And with his encouragement, I really kind of took science as a serious career opportunity for me and sought out opportunities because of him. So the work that I've been funded through the PhRMA Foundation to perform involves gastrointestinal stress. So lots of people have all kinds of stress in their gut. This can lead to a variety of symptoms like diarrhea, constipation, things that generally decrease patients' quality of life. So I'm really passionate about restoring quality of life and finding unique ways to do that. I study the microbiome. We know quite a bit about who's who in the microbiome, but not so much about what they do. It would be like receiving an employee handbook and having a list of everybody and maybe a vague description of their job titles. But that doesn't really tell you what their day-to-day looks like or who their direct report is or what teams they interact with. And so for me, I want to build out that employee handbook and then figure out how can I optimize how these employees are interacting with each other to help patients. My main goal is to send in a superhero bacteria that a patient could take orally. It would go through the GI tract and start living in the gut. And the superhero would help promote good interactions between the bacteria already residing in the gut that can alleviate some of these gut stress signals, those diarrhea, colitis at the molecular level. And I'm working both on the computational and the wet lab side, so that means I'm actually at the bench with a pipette building this bacteria. This is particularly cool because that means that a patient only has to take one pill every so often to get local in the gut where it's most needed administration of these helpful compounds that could be thought of as drugs. For the work that I do on the bench side, time is a really important variable. I have to monitor these bacteria for hours and hours and hours at specific time points. A really standout moment for me was the first time I had to do a really long one of these. I had to wake up really early in the morning and stay for a super long time. So I gathered up a bunch of snacks and brought my sleeping bag, and I just took little naps on the couch in our office space in between the time points. And it's a little bit goofy, but that's the reality of doing science. So the one thing that I think that people tend to forget about scientists and researchers is that we're just like you. We live in your community. We are your kids, we're your parents, we're your spouses, we're your neighbors. I'm just a kid from suburban Madison, Wisconsin. Just like you, I went to public school, K through 12. Anybody can be a scientist, and we're not sitting up here in our ivory tower making decisions. We really get into this business because we have a passion for asking questions and want to help people. And I wish that I could, say that to every person in America because science is so important to me, and I think we all have aligned goals in wanting to help people. If I had a time machine, could go talk to little Gracelyn, I'd make two main points. First, your ideas have value. If people don't see it, it's just that you're not talking about it right. Figure out how to communicate your ideas in a way that people can't ignore. That's my first piece of advice. My second, this goes out to any young girl in STEM and science, is be confident, be wrong, do it imperfectly, but you must do it. Speak up, take up space. Even if you're wrong, be wrong loud. Take up that space. I'm really interested in how microbiomes and these kind of microbial communities, whether it be, in the human gut, in the soil, in the ocean, up in space, how microbiomes respond to stress. My work on probiotics has really focused quite a bit on building tools and kind of validating this idea that we can send in that superhero bug and help strengthen those interactions when these guts are under stress. And I hope to expand this paradigm further in my career. And I see that kind of going through the more traditional route. I hope to start my own lab, mentor my own students, and collaborate with both academics and industry to actually bring these stress gut solutions to the patients who need it the most. It's all about helping people. That's, at the end of the day, if I can go to bed and say I learned something new that can help someone one day, that is the most important part of the job that I do. And so industry plays a really important role in that, and so does academia, and we should really work together. And I think it's really great that the PhRMA Foundation funds these early career scientists to kind of start building those collaborations early.